So this morning, we will be talking about research methodology class. We will discuss the classifications and types of study designs that are commonly used in health-related researches. And we will be discussing the basics of this one, the experimental, quasi-experimental, observational, qualitative, and mixed method designs. So ito yung parts or subsections of the methodology, and then you have to arrange, when you're going to write your methodology section, you have to arrange it like this, ha? So the first subsection is the research design, and then, okay, and then followed by research local, and then population and sample, and then these are the remaining parts after the populations and sample. Research protocol, when you say research protocol, it's the step-by-step procedure that you are going to do to gather your data. And then ethical considerations, and we have statistical treatment. By the way, baliktad yan siya. After the research protocol, you'll have the statistical treatment if ever your study is quantitative research or just data analysis for qualitative research. And then the last part of the methodology section is the ethical considerations. Okay? So sige, let us start with the research design. Research design is your overall plan for your research. Plan on how you are going to gather your data, or what data are you going to gather. So you have to clearly explain your research design in this section and give a rationale why you have chosen to do this type of research design. Now, we have different classifications of research designs class, starting with this one. Classification based on time. Okay, so there is a time element here. And what are these classifications? We have retrospective and prospective design. I believe you have read this one. If you have read journal articles, may mga nakasulat doon kung retrospective ba siya or prospective. So anong pinagkaiba ng dalawa? When you say retrospective, we are talking about the past here. Meaning, you will begin your study at the present, go back to the past, and end your study in the present also, in the present time. Okay? So, what's the example of this? Association between the use of phenylpropanolamine and the risk of hemorrhagic stroke. So, at the present, you will start your study here at the present, and then check whether this patient experiences or suffers from hemorrhagic stroke, and go back to the past, whether they have exposure to this kind of chemical agent. Okay? So, titingnan natin yung past nila. Kung meron silang exposure of this drug substance or chemical agent, then i-check natin kung silang lahat ba. And magkakaroon tayo ng conclusion at the end if there is really an association between this chemical agent to the disease or condition. So again, it's observing what has happened in the past. That's retrospective. Okay? Now, pag prospective naman, the study begins at the present but ends in the future. Okay, so our study will be progressing forward for this prospective study. So example, you have here the effectiveness or the duration of effectiveness of the vaccine, influenza vaccine sa mga elderly. So the researcher will have groups of individuals, groups na nabibigyan ng vaccine, and then group na walang vaccine, and then you will follow them for a period of time. So going to the future, ha, depende na kung anong time yon, maybe 1 year, or depende sa need ng study, just to check kung gaano kahaba yung efficacy ng vaccine. Gaano kahaba yung kanyang efficacy in terms of protecting the patient against influenza. So that's present to future. That is prospective research design. Pag bumalik ka sa past and then ends at the present, then that is retrospective. Okay, that is these two are the classification class based on time. Now, meron din tayong classification based on study purpose. So, ito yon, descriptive design. From the name itself, descriptive, the purpose of this study is just to give a description about your population or your variable in terms of their characteristics, or whatever that you are going to study, as long as at the end of the study, you can provide a specific description about them. Okay, so we will not be doing any intervention here. If there is a problem, if there is a disease, we will not be going to solve this problem, or we are not going to propose an intervention for that disease. No, we are just going to describe the situation, the phenomenon, or the occurrence. Okay, so the descriptive study may include case reports or case series reports. Pwede din siyang cross-sectional studies, yung mga surveys natin, surveillance studies, and ecological studies. So this one is an example. Yung the researcher would like to determine what community members think about the factors that do and should influence government spending on prescribed medicine. So if you're going to look at it, we have here what community members think. So basically, we are talking about perception. Now, if your study is about getting the perception of the respondents about something, that is a descriptive study. Okay, because at the end of the research, you can provide a description of the perception of your respondents. Included in the descriptive design, yung mga surveys class, yung knowledge, attitude, and practices na mga studies. Okay, like at the end of the study, you can have the conclusion whether the respondents have high knowledge or low knowledge about something. That's descriptive research design. So that's the purpose of it. It's the purpose of the research design. Now, we also have the so-called analytical design. So this is different from the descriptive research because our purpose in the analytical design is to identify risk factors. Okay, factors, any factor, risk factors, mediating factors, associated factors, etc. Now, we can gather our data for analytical research design via experimental procedures, or we may do observational procedures. Now, we have two types of analytical design, the case control and the cohort studies. I just don't know if you have encountered them, but yes, they do exist. And most of the time, this is used by, these research designs are used by medical practitioners just to identify factors of certain diseases, okay, occurrence of certain diseases. Now, let's start with the case control studies. Ayan. I will not read this one. I don't like a lot of words. Let's just concentrate on the illustration for us to understand what case control studies are. Now, take note of the arrow. Study begins here. So at the present, you are going to identify your study population and you have to divide them into two. So we have two groups here, cases and controls. What do you mean by this? When you say cases, these are the members of the population with the outcome of interest. Kung sakit pa ito class, ilagay mo dito. If your study is about lung cancer, okay? So, dito ilalagay mo lahat ng persons na mare-recruit mo na may lung cancer. Okay, that's for the cases. And then, Dito sa baba, you have the controls. These are the subjects without the outcome of interest. So sila yung mga taong walang lung cancer. Okay? This one is on the present time. Now, babalik ka sa past. That is a case control study. So definitely this can also be classified as a retrospective study. Kasi again, we are going back to the past. We are going to evaluate what risk factor or factors are present or absent for these groups of people. Okay? So sa mga lung cancer, titingnan natin, are they smoking? That's one of the factor that we may include. So i-check natin kung present or absent. That is also true for the control. We are going to check whether kung isang factor lang yung sasabihin ko dito and that is smoking, i-check natin if that risk factor is present or absent to them. Now, at the end of the study, we can conclude whether this identified factor is really a factor for the outcome of interest or for the disease or condition. So this is again called case control study. This is an analytical design used. Ang purpose niya is to check and determine factors, okay? Risk factors or associating factors. But please take note ha, you will begin your study on the present, identify people with the cases and walang sakit, and then go back to the past and see if the factors are present. So just like this one, this is the illustration here. At the present time, you have to identify people with the disease and group them into one. So that is called cases. And then we have here another group of people without that certain disease that you are going to study. So again, we call them control. And that let's go back to the past, whether they have exposures to the identified risk factors. Okay? Depende na yun kung anong factors ang gusto nating tingnan. Kung isa lang, then that's okay. Sa kagaya ng example ko kanina, we have the smoking. But there are really studies that they are going to check a lot of factors. So just like this one, you have risk factor A, B, C, and D, and identify what factors have the had cases in the control exposed sa past. Okay? So another example here, a group of investigators carried out studies to establish an association between the use of traditional eye medicines and corneal ulcers. In this case, both case control and cohort study designs are applicable. Now let's talk about case control first because that's another discussion later for the cohort study. So what are we going to do here? At the present time, you have the case here na group and then you have the control. Okay? So for the case, you are going to group all the people here with corneal ulcers. That's the case. That's the disease that we are looking into. And then control, ito naman yung mga walang corneal ulcers. And then we're going to the past, whether they are exposed to this kind of medicine, traditional eye medicines. And we will have the percentage at the end of the study kung ilan ang percentage sa na-expose netong risk factor na ito and ilan yung nagkaroon ng corneal ulcer so that we can have the conclusion whether this is really a risk factor for having this kind of condition. Okay? Now, another example here, this one aimed to investigate the association between aspirin and statin exclusive and combined and pancreatic ductal carcinoma. Adenocarcinoma. This one is a kind of cancer. And syempre, since risk factor ang hinahanap natin, you will have the case here with the pancreatic ductal adenocarcinoma and the control. These people don't have PDA. Okay? And then we are going to look at the past, whether they are exposed to this risk factors. These are drugs. I believe you're familiar with aspirin. If they are, ilang percent sa kanila ang exposed to aspirin plus statin, or ito yung combined, or yung isa-isa lang aspirin and statin na exposure. Okay? So, ayan yung example ng case control. Any question or clarifications? Alin doon yung hindi naintindihan sa case control na study? Baka may gusto kayong i-clarify. Wala. Sige. So, let's have the second type of our analytical research design. So, we have here the cohort study. Okay? So, marami ito. Kapag magbabasa kayo ng mga journal articles, marami kayong mababasang cohort study. So, paano naman ginagawa ang cohort study? You have here, pwedeng retrospective, pwede din siyang prospective cohort. Actually, this one is the reverse of the case control study. Kasi si case control study, mauna mong i-determine sino yung may condition, sino yung may disease and sino yung walang disease, tapos babalikan mo na lang yung risk factors. Sa cohort study, baliktad. Unahin mo munang i-determine sino yung nagka-exposure to a certain factor, sino yung wala, and then you progress, and then look whether they have developed that kind of condition or disease. So baliktad siya, kaya may nakalagay dito, study begins here. You have your sample and we will divide them whether they are exposed to the risk factor or they are not exposed to the risk factor. And then we will move forward and see whether they have developed the condition. Okay, so the outcome here is the condition. So itong may nakalagay dito, subject with outcome at 0 time are excluded in the study. Okay? May mga sakit, yung may mga sakit na at the time of the study class, hindi mo na siya i-include kasi nga ifa-follow mo pa yung pagde-develop nila ng sakit when it comes to kung may association ba sa exposure. So pwede siyang retrospective cohort na i-determine mo muna, sa past pa rin siya magsa-start. So like you move, you go back 10 years backward and see whether they are smoking. So lahat ng nag-smoke, dito sila. And then yung lahat ng hindi nag-smoke 10 years backward, isang group din sila. And then let's check at the present time whether they have developed the condition that you are looking for. May it be lung cancer, or maybe cardiovascular diseases kasi nicotine naman can cause cardiovascular diseases. Whatever, depende kung anong pag-aaralan mo na condition. Pwede din siyang prospective cohort. Medyo matagal lang tayong matapos with the prospective cohort class kasi you will begin your study at the present time and ilalagay mo sila whether they are included here sa may exposure and then dito sa wala exposure, and then we will follow them in the future who develops the outcome or the disease. So for example, if it takes 10 years for the disease to develop, wala na di nataka-graduate ani. So medyo mahirap gawin yung prospective cohort. So this is actually good for those, yung mga scientists, mga medical practitioners that are really into that kind of study. Pero kung college thesis pa, murag ito makakamana kung mag-prospective cohort tayo. Okay, so this one is an example of a cohort study. You have here a group of individual exposed to asbestos, and then you have another group which are not exposed to asbestos. And you're going to follow them who develops mesothelioma. So the condition is called mesothelioma. It's a kind of lung disease resembling pulmonary TB. So there will be scarring of tissues in the lungs, and they have the same symptoms like yung blood in the calf. Okay? Pero that is caused by asbestos. So that's a chemical agent. Yan yung example of a cohort study. Okay? Questions? These are under analytical research design and analytical research design is under the classification based on purpose. Dalawa lang yun. We have the descriptive. The purpose is to provide description about your respondents, about the situation or phenomenon, while the analytical research design's purpose is to determine risk factors. Okay? This is just to see actually if asbestos is really a risk factor of developing mesothelioma. Okay? Next, classification based on investigator orientation. Orientation mismo ng investigator. So just like me, my inclination or my orientation is more on the experimental research design. So since remember, I'm a pharmacist, I'm more into drug discovery. So definitely most of the studies I have accomplished are experimental in nature. So when you say experimental research design, we are looking for interventions and we are establishing here cause and effect relationship. So you know this very well. Experimental research design are comparing substances, example, whether they are effective or not. Okay, doing experimental procedures, syempre. Most of the time inside the laboratory natin sa school and doing laboratory procedures. So we have an example here, investigating the activity of new versus the older antihypertensive agents. So they have these patients here and then i-compare yung single pill combinations nila. Okay. So we are doing this in the laboratory also. You can do also experimental procedures in the lab. Like if you want to design a new diagnostic na procedure, and then syempre we are going to compare that with the existing ones. Mga antibacterial agents also. We are going to perform laboratory procedures and compare it to the antibacterial agents that we have in the market. Okay? Sige. So, this is our illustration for the experimental research design. Study begins here. This is identification of the sample, and then we are going to group them. This one is just an example ha, kasi most of the experimental studies that we have in the school have 3 groups. Group A is intervention. Yan yung, kung drug discovery, this will be, example, the plant material. And then group B will be the control. Sa school, meron pa tayong group C. Group B will become the positive control. When you say positive control, ito yung substance in the market that is already proven. Okay? For example, you are looking for an anticoagulant agent. You will have your plant material here, and then group B will be the positive control. You may use heparin, for example, and then sa baba, you will have the negative control. Ang negative control, nag-expect talaga tayo na wala talaga siyang activity. So just like water can be used as a negative control. And then after that, there will be measuring of outcome and comparison. So that's how we do an experimental procedure. Okay, but please take note, I am highlighting this kasi there should be randomization when it comes to experimental research design. If you have identified your population, your study sample, diba, we are grouping them here, but in grouping them, you have to observe randomization. Hindi pwedeng ikaw lang yung mamili, gusto ko yung blood na ito dito sa group A, yung blood na ito dito sa group B. That is not called randomization. When you say randomization, class, you have to give equal chance to all members of the population to be selected in your study. Hindi lang yung kasi gusto mo. Kasi kung mag-survey ka na experimental ang procedure, pwede kasing gawin yon. Hindi pwedeng, ito gusto ko siyang piliin dito siya sa group A kasi friend kami. Hindi ganon. That is not called randomization. So when we do randomization, most of the time we use fishbowl method, bunot-bunot in short, or we do lottery method, or yung mga wheels of names if we are going to use application softwares. Ayan. That's how we give equal chance to all members of the population to be selected in our study. Okay. Okay. Now we have the so-called quasi-experimental research design. This is still experimental in nature, but we cannot call it true experimental. Thus the name quasi. Bakit? You have the same here, class, the same thing that you're going to do, the same illustration, but take note of this red one. If you don't observe randomization in the assignment of your samples per group, then that cannot be called true experimental study. It will just be quasi-experimental. Quasi is false. Remember? So false yun siya. Kasi in doing experiment, we really have as much as possible to get rid of all the biases, causes of variations. Kukunin talaga natin yan. I-avoid natin yan. So kung one way to get rid of the bias is doing randomization. Okay? So please take note of that. Now, meron din tayong under sa classification na ito, observational design. Actually, this is the same with that of the analytical research design. Kaya ang under din dito yung cohort study and the case control study wherein we're just going to observe phenomenon and we will not be giving interventions. Okay? So, associations lang ang hinahanap dito. Kaya yung mga risk factors associated ba siya sa pag-develop ng sakit. Hindi tayo nag-establish ng causation, cause and effect relationship for observational design. So, this is still included in the third classification and that is based on the orientation of the researcher. Okay? Now, classification based on question orientation. Please take note of this because ito yung ginagawa natin sa school. Ito yung pina-follow natin sa school. This classification. Based again on question orientation, the question here is referring to the statement of the problem. Okay, remember if you have your paper now, gagawa ka na ng SOP mo and based sa SOP doon tayo magbe-base sa research design na gagamitin. So even sa chapter 1, I have mentioned this already kasi ito nga yung ginagamit natin. Qualitative, remember, is concerned with qualitative phenomenon, those phenomenon that cannot be quantified. So, no numerical data. Pag quantitative, basically, meron tayong numerical data here. Okay? And mixed method design, kapag gusto nating paghaluin yung linguistic data and numerical data natin. So, for the whole research life ko, I have only made one mixed method design wherein I think that's pharmacology. Meron ba kayong pharmacology? I think meron kayong pharmacology na subject sa medtech. Nag-conduct ako ng study about pharmacology sa mga students. So I have numerical data when it comes to their academic performance. And may mga ibang numerical data pa ako aside from academic performance. And at the same time, I interviewed them. Nag-interview din ako sa kanila. Ano yung like experience nila sa pag-learn nila ng pharmacology, mahirap ba or hindi, saan ba sila nahirapan and so on. So I have two types of data, linguistic and numerical. Yung time ninyo, natanggal na yung pharmacology. Okay. So, wala na pala kayong PCOL. Kasi I remember last time, they had their pharmacology. Pharmacology is the study of drugs. So, tinanggal na pala sa inyo. You don't study drugs anymore. Okay. Focus na lang kayo with your diagnosis and other things sa medtech. Okay? Wait lang ha. Sige. Now, let's talk about these three. Isa-isahin natin sila. Starting with qualitative research design. So take note of this. They are data-free or hypothesis-free. I'm talking about numerical data here. Wala tayong numerical data dito, only linguistic data. And we don't have hypothesis here. Remember, hypothesis are educated guess, tentative solution to the problem. Sa qualitative research class, we are not really giving an intervention. So we are not proposing any solution to a problem. This is more of like exploration for qualitative research design. So therefore, we do not seek generalization here, especially if our study is phenomenological in nature. When I say phenomenological, we are talking about experiences. Okay? Remember, we cannot generalize experience. The experience of one person may not be true to another person. Okay? So just like when we are going to go back, if your study is narrative or historical, if we are going back sa history and interview people with first-hand experience with that situation or phenomenon, we cannot really generalize kasi yung iba magsasabing maganda yung kanilang experience during that time, yung iba magsasabing hindi. So yan yung ibig sabihin na kapag you have linguistic data for qualitative research, we cannot do generalization. And at the same time, the data that we are collecting here are data from non-probability sample. What does it mean? I am assuming you are done with your statistics. Kasi nga naka-research kayo. Yung alam ko talaga na prerequisite for research is statistics. So sa statistics, nagdi-discuss tayo ng probability sampling design or probability sampling technique and non-probability sample. Anong pinagkaiba nila sa statistics? Nag-discuss ba kayo nito? Wala. Any idea? Any idea about this one? Probability and non-probability, mga tanat sa ilaha, basig natulog na ni sila. Ang dili mo tubag, natulog na. Absent. Atong tawagan, magbintot-bintot, dinhi sa participant. Wait lang. Lorraine. Lorraine. Si Lorraine. O, natulog na ni. Absent na ni. Walay. Any idea about probability and non-probability sampling? You can unmute your microphone or you can send your answer sa group chat. Ay, sa group chat. Sa chat box ha. Wala, natulog na ni. Absent na ni. Garcia is absent. Charot. O, nag-type pa. Probability refers to chances of getting the result while statistics is getting the summary. Hindi ako sure. Okay, pag sinabi niyong probability sampling technique, ganito yun ha. Ito yung binibigyan natin ng equal chance. Equal chance yung members of the population to be selected in the study. So tama yan na pag probability is unbiased. Okay? Unbiased siya. Kasi ito, Walang equal chance. Ano ibig sabihin? Ganyan. Example, maganda kayo ng survey class. Tapos, your target respondents are residents of General Santos City. Okay? Again, your target respondents are the residents of General Santos City. When we conduct survey, it doesn't mean na lahat talaga ng residents ng Gensan bibigyan mo ng questionnaire at papasagutin mo sa survey mo. Hindi siya ganon. Magsasampling tayo. That's what we are doing for research and for statistics. We do sampling, meaning kukuha lang tayo ng representative galing doon sa population natin. Now, paano natin siya gagawin? Pag probability sampling, we will be giving equal chance to all the member of the population to be selected as sample. So, yun yung sabi ko kanina, pwede tayo mag-lottery method, magbunot-bunot tayo, fishbowl method, and kung sino yung mabubunot, yun yung bibigyan natin ng questionnaire and papasagutin natin. Okay? Sa survey natin. Pero nevertheless, unbiased yun. Kasi hindi mo naman alam kung sinong pangalan yung nakasulat dyan sa bubunutin mo, pero they have equal chance. Okay? Meron silang equal chance. Yun yung ibig sabihin ha. Kaya tinatawag na unbiased o kaya random. I hope that is like clear, di ba? Even sa example, drug testing, di ba sa school kung magpapa-drug test, kung hindi lahat yung ida-drug test, nagra-random sampling lang sila. So, ang ginagawa niyan, bibigyan lahat ng chance ng students na ma-select doon sa drug test. So, either they do lottery method, wheel of names, bubunutin nila, fishbowl method, kung sino yung mabubunot, yun yung ipapadrug test. That's probability sampling. Okay? Kung hindi lahat yung ida-drug test class. Pero pag sinabi mong non-probability sampling or non-probability sample which we are going to use sa qualitative research design, ito yung hindi random. And hindi natin mag-get rid yung bias dito. Walang equal chance. Okay? Example, mag-interview kayo ng medtech sa hospitals sa General Santos City about their experience of working as a medical technologist. Now, pupunta ka doon. Example, punta kang St. Elizabeth. Kung non-probability sampling ito, kung sino yung andon, kung sino yung on duty, yun yung pwede mong mai-interview. So wala nang equal chance. Kasi paano yung hindi nag-duty? Meaning, hindi mo na sila agad-agad ma-interview. Wala na silang chance para ma-interview. That's a non-probability sampling. O kaya, mag-interview ka ng medtech, tapos ikaw may kakilala kang mga medtech sa hospital. So yun na lang yung i-interview mo kasi kakilala mo na sila. So wala na ding chance yung mga hindi mo kakilala. Yan yung ibig sabihin ng no equal chance for non-probability sampling technique. Okay? Kasi tinatanong talaga yan siya ng mga panelists during the defense. Kaya I really need to give you a review of this. Review lang siya kasi this is actually a topic sa statistics. Okay? Anong tawag sa kanila? Probability. This is called sampling technique. We use this in selecting our sample. Kasi we don't really usually do population na study. When I say population na study, yung lahat talaga i-include mo. We don't do that. Paano kung 1,000,000 ang resident sa Gensan? Dugay kay kamahuman. So, mo na nga nagakuha lang tag-sample. Remember, samples are representatives of taken out from the population. I hope that is clear. You have questions about this one? Para dili ta masaag ha. Kay basig mo gid na una ba yung pangutan-on sa kadaghan ako og kanang defense na naagian. O dyan na una pangitaon, what is your sampling technique for this research? Yan talagang unang i-ask. So you have to be clear with that. Ano ba talagang gagawin ninyo? Ayan. Wala namang tama or mali dyan with kasi decision nyo naman yan as a researcher. Pero kaya lang kapag quantitative kasi ang research, mas maganda kung probability sampling yung gagawin ninyo. especially if experimental, kasi kailangan matanggal natin yung bias. Pero sa qualitative research, most of the time, we do non-probability sampling technique. And most of the time, we do not really convenient sampling. It's the purposive sampling. Sa purposive sampling, under yan siya sa non-probability sampling ha. Yung meron tayong criteria na hinahanap para masabi natin na pwede natin siyang i-interview. So, for example, gusto mo lang medtech sa Gensan. Kailangan medtech talaga sa Gensan. Hindi na kasali yung mga medtech doon sa labas or whatever. So, meron tayong parang criteria. So, walang equal chance yun, di ba? Sa lahat ng medtech. Kaya, non-probability sampling siya. So, what are these types of research design under the qualitative research design? You have here narrative, phenomenological, case study, and ethnographic. For ethnographic class, na-discuss ko na ito sa inyo, i-review ko lang konti. Pag ethnographic, you are going to study the culture, the tradition, the customs, or the behavior of a group of people. It does not necessarily mean na tribe talaga or like, anong tawag dyan? Native people. Hindi naman talaga ganon. Basta group of people lang. And then, if you want to observe their culture, ayun, ethnographic yun siya. So you can live with them, observe what they do in a real life situation, and you may also interview them, like how they do things. For example, how they diagnose diseases or how they treat diseases. That's ethnographic. And then phenomenological class, kadugtong niyan ang experience. Pag narinig nyo, phenomenological study, automatic experience yan siya. Meaning, we are exploring the experience or experiences of our participants about a certain occurrence, phenomenon, or situation. We may do interview sa kanila, meaning walang hypothesis ito din ha. Mga qualitative research, walang hypothesis. Wala naman tayong ibibigay na intervention kasi nag-explore lang naman tayo ng experience. Okay? So, inanarrate natin yung experience ng ating participants. Na pag case study, this is an in-depth investigation. So, like, you have like one person, tapos pag-aaralan mo talaga siya ng maigi. Example, meron siyang sakit, Kawasaki disease, manayahang sakit. Tapos, talagang i-observe mo siya and yung investigation mo in-depth starting from the signs and symptoms, isulat mo talaga yan lahat, yung mga na-experience niya from the start nang nagkasakit siya and everything. That's a case study. Okay? And then, narrative, more on like just stating the answers of your participants, but we have to arrange them in chronological order. So sa narrative, this is more on like historical researches. Yung mga historians natin, if they are going to do a narrative research, syempre, they will go back to the past, they may interview people with first-hand experience about that situation, or they may observe like mga artifacts, di ba? May mga artifacts sa past. And yan yung isusulat nila in chronological order. Okay, may pasunod-sunod yan siya class. So again, pwede siyang, most of the time, it's historical research. Okay, so yun yung mga different types of research under the qualitative research design. Questions about that? I just cannot remember whether merong nag-propose ng qualitative research sa inyo doon sa inyong concept paper. Let's see, baka may ma-approve doon. So definitely medyo makapal ang paper for a qualitative research kasi maraming words. Remember, linguistic data ito lahat. And kapag nag-i-interview ka kasi ng tao, doon sa transcript of interview, isasalin mo yan siya lahat, verbatim. Isusulat mo kahit yung isusulat mo talaga yan sa paper mo. So, kaya medyo mahaba yung qualitative research. But yung quantitative research, hindi naman siya masyadong makapal yung paper kasi everything will be summarized using mathematical concepts or statistical concepts. So we have numerical data here, and the data are directly obtained from an actual observation or even experimentation. And this one is the reverse of the qualitative research kasi we can have generalizations here, we can make inferences, projections, and even our conclusions about something. So, pwede nating ma-generalize. Experimental man yan or descriptive. Sa descriptive, makaka-generalize tayo ng description natin sa ating participants. So, example, we are studying their knowledge. So, at the end of the study, we can give a generalization whether mataas or mababa yung kanilang knowledge about something. Okay? That is also true for experimental research. Okay? So, what are the types of descriptive research designs? Unahin muna natin si descriptive types. Under ito po sa quantitative research design. So we have here surveys. So if you're going to collect a lot of information at the same time, you are going to do surveys. Pero we have two types of survey. Yung descriptive survey class, ito yung ang iyong research, yung iyong tool, research instrument, yung iyong questionnaire, pwedeng ikaw lang ang gumawa, pwede namang adapted pero meron kang binago. Okay? Pero pag you're doing descriptive normative survey, talagang gagamit ka ng tool or ng questionnaire na parang accepted na siya, and yan talaga yung ginagamit for us to get a certain information. Example nitong descriptive normative survey, yung 'di ba may mga tools na ginagamit for testing ang mga psychology natin, mga psychology students. Meron sila example, testing material to check whether a person is depressed or not. So yung testing material nila doon, ano na yun siya, proven, tested, and widely accepted na yun talaga ang tool to know whether a person is depressed or not. Okay? So kapag ganun yung study ninyo, there's descriptive normative survey yan siya. Okay? Anong pag tatanungin kayo ng panel, what is your research design? Ang sasabihin nyo is quantitative, descriptive, survey, research design. So yan yung tawag. Talagang mahaba yan ha kasi we have to be specific. Quantitative siya, descriptive, and survey research design. So what are the examples of our surveys? We have here stress. Palitan lang natin kasi may PowerPoint is like saksak sinagol na no. Kay different na mga departments yung tinuturuan ko ng research. So like palitan natin stress and coping strategies of medical technologies in hospitals. Okay, working in hospitals. So magkakandak ngayon ng survey kung gaano sila ka-stress, sample level ng stress nila, and then how they cope up with it. That's a survey. Okay? Pwede din namang stress and coping strategies of students. Kaya parehas ngayon, I believe you are stressed with your ACADS. So pwede din yung study, yung level of stress ng mga medical technology students and their coping mechanisms or coping strategies. Yung mga surveys about job satisfaction also, that's a descriptive research. Kasi at the end of the study, you will have to provide description on their job satisfaction. Okay? Yung mga research about leadership skills, about being productive or not, yung mga studies sa academic preparation, and then yung results sa board exam, survey lahat yon. Okay? So descriptive lang ha, kasi again, at the end of the study, description lang yung mapoprovide natin. Now, kapag descriptive, quantitative, descriptive, developmental studies naman, iba na naman ito. Kasi pag this developmental studies, from the name itself, developmental, you are going to devote a period of time in your life to observe the development of a certain individual or a group of people. Okay? Development ang pinag-uusapan dito. So, kailangan mo ng time nito. Kasi nga, hindi naman magde-develop ang isang bagay ng masyadong mabilis lang. So, again, kailangan ng time. So, we have here two methods for the developmental studies, longitudinal and cross-sectional. Now, how do we do longitudinal developmental study? You will have to study the same sample of participants over an extended period of time. So, kung kaniin yung buhaton, murag di ta-graduate ani. Kasi example, you have first-year students. You want to check their development when it comes to their mathematical skills. So, susundan mo sila starting from first year, susukatin natin yung mathematical skills nila, tapos pag second year na naman, pag third year, and then pag fourth year. Susukatin natin ang development from first year to fourth year sa kanilang mathematical skills. So definitely, you need an extended period of time for this. And then again, longitudinal is the same sample. Kung sinong mga tao itong first year na pinag-aralan mo, yun pa rin sa second year, third year, and fourth year. Again, that is longitudinal method. And then a study on radiologic technologies in the hospital laboratory for the first 5 years of service. So, yung first time nila nag-work sa hospital, ano ba yung kanilang skills na alam, ano ba yung kanilang parang score as for their efficiency, ganon. And then, we will follow them for the next 5 years kung paano nag-develop ang kanilang skill. So, the same persons yun. O kaya itong study sa last, a study on autistic children from 1 to 5 years old. So, definitely that's for their development also. Kung ano ba yung alam nila, ginagawa, skills of an autistic child starting from 1 year to 5 years. So again, longitudinal method ito. Descriptive lang ha, kasi at the end of the study, description lang naman pa rin yung makukuha natin. Description ng kanilang development. Now, since mahirap gawin yung longitudinal method kasi mahabang time yung kailangan, we may do cross-sectional method for our developmental studies. So ano ito? Mag-aaralan pa rin natin yung development, pero we may study different set of participants over at the same time. So example, yung mathematical skills pa rin class. So ang mangyayari ganito, bakit ayaw mag-function ng aking pen? Wait lang ha. Sinipit yung pen. Right. Nangyari. Ay, ayun. Okay. So, mathematical skill pa rin. Skills. Ayan, baliktad. Okay. Pero, hindi mo na siya yung susundan talaga. Pwede mong i-check yung mathematical concepts or skills ng students sa first year. Tapos, ibang tao ito. Tapos, kuha ka ng another group here ng mga fourth year. Tapos, ano mo na lang, i-differentiate mo na lang yung mathematical skills or concepts na dinidiscuss sa first year and sa mga fourth year. So, again, at the same point in time, magkaibang tao. Pero you can still see the development kasi you can have the comparison. Okay? That's the difference between cross-sectional and longitudinal method. Any question? Baka may gusto kayong tanungin about the different types of descriptive research kasi isa pa to sa tinatanong during the defense. What is your research design? So you have to be clear whether quali or quanti. If quanti siya, anong klaseng quanti yon? Descriptive ba or experimental? Kung descriptive, anong klaseng descriptive din? Survey, developmental, assessment or evaluation, comparative, correlational, or a follow-up study. You have to be clear with that. Okay, so kung walang question, we have here the assessment or evaluation studies. So assessment or evaluation, from the name itself, alam niyo na kung anong gustong kunin nito. Mag-evaluate lang tayo sa ating mga respondents or mag-a-assess tayo. So example, the use of scanners in determining sex of babies. Example, di ba sa hospital, we have like scanners to see kung babae ba or lalaki yung baby. So i-check natin, i-evaluate natin kung talaga bang efficient yung scanner na yan. Magbibigay ba siya ng 100% na tamang result or hindi siya, may mga percentage siya for error. Okay, that's again assessment or evaluation. Pwede din capabilities of freshman students entrance in College of Nursing. Okay, so i-check din natin yung mga skills, mga abilities ng ating freshmen sa nursing or sa medtech department. That is still assessment or evaluation. And then performance of graduates in RadTech licensure examination and the factors that influence it. So i-check natin yung performance ng mga graduates natin doon sa board exam. And then after that, kukunin natin yung mga factors. Bakit kaya sila nakapasa? O bakit kaya hindi sila nakapasa? That is descriptive assessment or evaluation research design. Okay? Any question or clarification? I'd like to finish na lang all the descriptive researches, and the next meeting, we will discuss all the experimental research design. Okay? So sa comparative class, makikita niyo yung SOP nito kasi may question na, is there a significant difference? Okay? Again, for comparative research, tingnan niyo yung SOP. Pag may nakalagay dyan, is there a significant difference between this variable and another variable? Automatic, we call that quantitative, descriptive, comparative research. Comparative because we are comparing two variables. That's different from the developmental studies kasi what we are looking here is the development. Though we have comparisons also here, pero this is more on the development, like example of the skills of a person, like that. Pag comparative, it's between one variable to another variable. Like, magkaiba ba ang working efficiency ng mga babae sa mga lalaki? That's comparative. O kaya mas magaling ba yung mga babaeng medtech kasi sa mga lalaking medtech? Comparative study yon. Okay? Or mas magaling ba sa phlebotomy yung mga 4th year or yung mga 3rd year students? Ganun yung comparative research. Okay? Now, for correlational naman, from the name itself, correlational, what we are looking here is the relationship or association. So if we are going to look at the SOP, ang question naman nito is there a significant relationship? Kung hindi relationship ang ginamit, pwedeng association. Okay? So is there a significant relationship or association? So what are the examples of this correlational research? Example, relationship between management styles and leadership dimensions of managers of a certain business firm. What we are trying to seek here is kung meron bang relationship ang management styles doon sa leadership dimension. O kaya, role of personality factors on stress experienced by pharmacists working in the community. Yung stress level ba ng mga pharmacist associated ba doon sa kanilang personality? Ganon. So most likely relationship lang ito. Sa relationship kasi yung hinahanap natin, pag tumaas ba yung value ng ganitong variable, does it mean tataas din yung another variable, yung kanyang value or bababa? Anyway, both have relationship. Kailangan lang natin i-define what kind of relationship. Directly proportional ba or inversely proportional? Okay? Pag directly proportional, for example, if mataas ba yung, or if maganda ba yung management style ng isang person, would that mean mataas din yung kanyang parang scores on the leadership dimensions niya? Okay? Kaya the other way around. That's correlational study. O kaya yung sa knowledge and practices. For example, about dengue. Kung mataas ba yung knowledge ng participants sa dengue, would that mean they will also like practice? Mataas din yung pag-practice nila when it comes to yung mga practices natin to yung parang prevent transmission. So yan, kukunin natin ang relationship of the two. That is a correlational research. So if we're going to look at the SOP, talagang makakakita ka ng question na is there a significant relationship? Okay? And lastly, for our descriptive studies, we have follow-up studies. So ito yung mga tracer studies. Marami tayo sa school nito, yung tracer studies. Yung itatrace mo, saan na yung graduates? This is more on the graduates class, yung follow-up studies. Like yung mga nag-graduate na ng medtech sa school, fina-follow up sila through research. Kung nakapasa na sila sa board exam, and saan nag-work na ba sila? Saan sila nag-work? Sa private ba or sa public hospital ba or sa community, whatever. So this is just a follow-up studies. Most of the time we do follow-up studies to check, example, the employability of our graduates. Kung mabilis ba silang ma-employed or hindi, or kung related pa rin ba sa kanilang course yung kanilang trabaho. That's a follow-up study. So I will end here. Next meeting, we will be discussing experimental research. So experimental research, just like our descriptive research, may different types yan. Actually, mas marami pa nga ito. So, ito marami siya. Para alam nyo anong gagawin ninyo pag nag-experimental research kayo. Bigyan ko lang kayo pala ng example. Wait lang ha. Ano mukha ng methodology? Yung the same example na lang pa rin kasi wala naman ako mabigay sa inyo. I don't know your studying pa naman. So yung, di ba, ito yung present ko sa inyo last time, medical fake news and fear-mongering during the COVID-19 pandemic, the impact on the vaccine confidence among the millennials. So titingnan natin yung SOP nila. What is the demographic profile? What is the level of influence? And take note for number 3, is there a relationship between medical fake news and fear-mongering during COVID-19 pandemic on the vaccine confidence among the millennials in Gensan? So yan yung question nila. Kasi sabi ko kanina, ang ginagamit natin sa school is yung classification based on question orientation. So let's see their methodology section. Wait lang ha, kasi mahaba yung RRL. After kasi ng RRL, ayun na yung methodology class. It's a separate section in the paper. And next page na supposedly ito ha, na doubt lang ang iyahang format. So you have here the methodology. We just call it methodology, walang chapter. You will have a little introduction, just introduce what is the content of this section. And then we have the first part here, the research design. So let's see kung anong research design ang ginamit nila. We have here a quantitative method. So their study is a quantitative research design, and take note of this. They have properly identified it in their paper. The researchers employ descriptive research design, specifically correlational. So this is correct. Remember, we have read a while ago their SOP asking about the relationship between their variables. So yun yung ilalagay nyo, i-identify nyo under the research design, and you explain bakit siya naging descriptive correlational. Okay? So yan yung unang gagawin nyo for the methodology section. But anyway, di pa tayo tapos kasi quali and quanti-descriptive pa lang. We still have the experimental research design next week, and at the same time, the mixed method. Tapos after that, we will move on to the other parts of the methodology section. Okay? For the meantime, do you have questions or clarifications? Wala? Please, again, please help me with